seems like we've reached the end game for the pandemic in many cases. Zero COVID strategies have been abandoned. Vaccinations are keeping cases down. And now the announcement from Merck as a pill that could radically change the way it's being managed. Shares in the vaccine maker Pfizer and Moderna are down very sharply. Well, not so much for Pfizer now. It was off earlier. Moderna particularly, but that is a one-trick pony, Moderna. So if vaccines aren't so significant or as significant, then Moderna will hit it much more than Pfizer. Dr. Saad Omer is the director of Yale's Institute for Global Health. He's with me from New Haven in Connecticut. Good to have you, Doctor, on a Friday. Now, so judge for me the significance, please, or assess for me the significance of the Merck pill and this idea of now basically, because if you take the Merck pill and you add in Australia's announcements, you basically get to a view of we're living with COVID.
I think this is a very good day in the pandemic world. Obviously, this is not the end game right now, but this is significant progress. And the fact that this is an oral pill means that it can be delivered in places where intravenous therapy is not possible. It can reach more people earlier in their disease course, etc. So this will have substantial impact. One thing I should clarify, that this is a complementary strategy to vaccination. It doesn't replace vaccines, but it is a pretty substantial tool in our new toolbox.
If most of the world is not going to reach the holy grail of herd immunity, 80–90%, then we end up with the sort of life we've got at the moment. And I'm not sure I see a way out of that, Doctor. I mean, I go about my life here in New York. I go to restaurants, I go to cafes, I go on the subway. Sometimes I wear a mask, sometimes I don't have to wear a mask. Is this the future for the foreseeable?
Fortunately, no. It will be a dimmer switch. It's not going to be, bright all of a sudden and things will be normal. Things will improve if we do this right. It's not a given, but there is a path out of this. And the path out of this is that the virus is likely to become endemic in the sense that through vaccination and plus through immunity induced by infection, there will be a significant number of people that do not provide sufficient levels of protection to eliminate the virus, but enough that it appears in terms of these flares that attract attention, but they do not disrupt the life at the national or global level.
Okay, but what about this sort of panic crisis when somebody you know or you've been at dinner with a day later turns COVID and you then have to self-isolate or this, that or the other? At what point do you think, and I'm talking about vaccinated, fully vaccinated people, at what point will we be in a position where if a dinner guest the next day says, oh, I've come down with the flu, you just wish them well but go about your business?
I think we will be at that level of certainty and mental comfort when the rates go down to levels approximately around early summer in the US, for example. And then, so the bottom line is when the rates go down, and these are the mechanisms to get there. The other thing is today's news adds another layer of protection that even if a small proportion do get sick at that level, we have another more convenient and reasonably effective tool to take care of them. So all of this will help us get there. We are going in that direction. I am a little bit concerned about a winter flare-up in a few countries. But overall, I think that the long-term outlook looks good.
I was going to say, don't pour water just yet. Let's leave on a high note for a Friday. It's a good day with the pill and with Australia and with his announcement. And it's good to have you, sir. I wish you well for a good weekend. Thank you.